Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of religious adults who were very creative.
Down on the floor and play with their kids.
AFMC TV. Thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. And today I have with me Dr. Srinivasa Gokarakonda. Dr. Gokarakonda, thank you so much for being here.
Thank you for having me, Robin.
So you are the medical director of Six Bridges Clinic. Tell us a little bit about Six Bridges.
So Six Bridges Clinic is a clinic for teens and young adults that use substances. So we see patients anywhere from ages 12 to 21. And this clinic is funded by Blue and You Foundation for Healthier Arkansas through their Blue Behavioral Health Initiative for Arkansas, mainly to support screening and identification of substance use disorders in teens and young adults, and also provide treatments for those disorders.
And what sets your clinic apart? I mean, you talk about that it's for a younger demographic. That sets you apart from, let's say, the atypical healthcare provider clientele.
Yeah, so this is the first of its kind of clinic in the Arkansas because, we have several providers that provide treatments for adult substance use disorders, but this is the first clinic in the state that provides teen substance abuse treatments in the state.
And you've not been open terribly long, about a year?
This clinic was opened in March 2024 at UMS Psychiatric Research Institute.
And what are some of the most pressing health issues that you're seeing in the community right now?
So right now, as far as the substance abuse is concerned, we have about 1 million adolescents right now that use substances across the US, right? That is 1 in 4 teens abuse substances. In Arkansas, in addition to the substance abuse, we have problems with diabetes, hypertension, obesity. These are some chronic diseases that we see a lot in addition to the common mental health disorders and substance abuse.
And when you say substance abuse, is that alcohol? Is that drugs? What are the common things?
So the most commonly used substances include marijuana, alcohol, and tobacco. Tobacco by far is the most commonly abused substance in both teens and young adults, and as well as adults.
And how does your team approach treating both physical and mental health challenges? Is it an integrated model?
Yes. So about 50% of people with mental health disorders also have substance abuse disorders. So that is about 21 million adults in the US that have co-occurring mental health and substance abuse disorders. So we provide team-based approach, which is interdisciplinary team with the physician, a nurse, and a social worker to provide a dual diagnosis, which is both mental health as well as substance abuse treatments, so that we can provide all the care in one place. In addition to that, we also offer other services, which is like a wraparound services for if somebody needs help with food insecurities, somebody needs transportation, things like that. And also if somebody needs specialty care, we also refer them to our Arkansas Children's Hospital, which is a collaborating hospital with us. And we also have UMS to refer patients if they need to go to seek specialty care.
So this is far-reaching, not just about seeing a provider. This kind of encompasses the whole health.
Yes, it's like a single point of entry. Once you enter the clinic, we have all the other services that are available for the patients and families to take advantage of.
And it sounds like there's pretty extensive partnerships and collaborative efforts too.
Yes. So we as a clinic has formed a community advisory board from the community, which includes people from Department of Education. We have people from American Academy of Pediatrics Arkansas chapter. We have people from American Foundation for Suicide Prevention. We have a lot of organizations like Immerse, Wall Street Foundation. We have several organizations that we partner with. So this is to help us understand the problem at the community level and also identify the barriers for these treatments. And also these community partners also help us with referrals to our clinic. So we receive a lot of referrals from Arkansas Children's and also other partners in the community.
And do your patients have to be from this part of the state? Do you see anyone? How does that work?
So right now we are seeing patients only in the central Arkansas area that can be like people that can drive to our clinic. But in future, we will hope to expand our services via telehealth. The biggest barrier for expanding for telehealth services is because we require the drug screens that are done in person. So that is the only barrier that we have right now. So once we find a way to resolve that, we might provide services across the state.
Are they mostly from referrals, like through patient care through a PCP, or how does that work?
So right now we have, through our community partners, we have encouraged primary care physicians to screen more teens and young adults when they come to their annual visits. Once they screen positive for substance use, whether it be tobacco, alcohol, or marijuana, any substance, they can refer them to our clinic, and then we will provide the services for them.
So how important is early intervention for improving long-term health outcomes, especially in under-resourced areas that you're seeing?
Right. So let me talk about Arkansas first. So according to the Arkansas Prevention Needs Assessment Survey that was done in 2023, the average age of a child using a substance is 12.2. So 12 years of age. So this is way earlier than the 2018 survey that showed the average use was about 13 years of age. So currently more and more young children are experimenting with substances, nicotine, vaping, marijuana, and alcohol, which are freely available now. So that's a concerning situation for us in the state. So that's why we need to screen them early. We need to provide those treatments early enough so that we don't want these children to become a chronic substance users.
And are you seeing an increased demand for mental health services, and how are you responding to that need?
So yes, definitely we are seeing increase in our referrals. We have anywhere we receive about 100 referrals every week or every month through different providers in the state, not just for Six Bridges, for our child mental health clinic. So this is because we've seen the lingering effects of the COVID pandemic, and also increased social media use. And then also there is some increased awareness in people seeking help for mental health issues. So with combined all these things, we are seeing more and more people approaching providers and their primary care providers, and also us directly seeking mental health care.
What role does trauma-informed care play in your practice and your patient interactions?
So trauma-focused approach is one of our foundations of care at UMS and also at the Child Study Center where we practice. So basically, if a child is exposed to trauma or adverse childhood experiences, it increases the risk of mental health issues down the lane and also substance abuse, right? If they have more than 4 or 5 adverse childhood experiences, there is evidence that shows that there is increased risk of depression, anxiety, substance abuse, and all kinds of mental health issues. So we are very cognizant about those issues, and then we treat every patient with welcoming them to the clinic and providing them more inclusive and non-judgmental approach to providing our care.
And how does your clinic, you touched on this a little bit about building trust and to where they know who may be skeptical of the healthcare system due to past experiences or cultural barriers. Do you see those as well?
Yes, the biggest barriers to seeking care is definitely stigma, and also lack of insurance sometimes. And then, there is a lot of health disparities that actually also become a barrier to seeking care. So we are at our clinic, we welcome them and with a non-judgmental, inclusive environment, and provide the care, which is a patient-centered care. And then we involve the patients in their treatment plans. So that way we can build trust with them for engagement in the treatment and for long-lasting relationships.
What advice would you give physicians that are outside of the Central Arkansas area that are trying to connect more deeply with the communities that they serve?
So understanding the barriers for care, like inequalities or disparities in health access, and also building the trust with the patients is very important. If you build that trust, patients are open to sharing things that will actually help them to seek mental health care or substance abuse care. So I request every physician to spend a little extra time to understand what the patients are facing so that they can build that relationship and trust with those patients.
And you mentioned about partnerships. What do you want the community to know? Are there opportunities to collaborate, or stakeholders, people that you think that want to give back or that could contribute, that might have resources to help?
So as mentioned earlier, all these partnerships are very important to provide a collaborative care for these patients in need of substance abuse treatment and also mental health treatments. So right now, Six Bridges is partnering with a National Center for Opioid Research and Clinical Effectiveness, which is funded through the Attorney General of Arkansas and a partnership with Arkansas Children's. So that organization is actually working to prevent opioid use disorders and also treat young children that are affected by opioid use. We are partnering with them in preventing substance use disorder in teens and young adults. So partners like that will help us build more networks so that we can provide better care for Arkansans.
So in close, how can other healthcare professionals and organizations, what do you want them to know, particularly from healthcare providers learning? Should they do some education on how to screen for these things? I mean, what does that look like for the future of Arkansas?
So being open to learning is very important because, there are providers that have been practicing for a long time. There are new trends in substance abuse, new screening tools in substance abuse disorders that we all need to know. So that is, that is done through more learning. So like I said, the American Academy of Pediatrics recently finished an Project ECHO presentation for primary care physicians on how to screen substance abuse in these young children and young adults. So capturing those opportunities, learning opportunities, and then be up to date with the trends help people with more knowledge and also referring them appropriately to appropriate clinics, just like us at Six Bridges Clinic.
Well, Dr. Gokarakonda, thank you so much for being here today and sharing the mission of Six Bridges and all that you do for the area in Central Arkansas. Thank you so much.
Thank you, Robin. Thank you so much for having me.
And that's it for AFMC TV. Have a great day, and thanks for watching.